We're now joined by Kate Judge, Executive Director of the American Nurses Foundation. Good to have you with us, Kate.
Great to be here, Steve.
I want to thank our friends at Johnson & Johnson. Big supporters of nursing around this nation, and they told us all about you and your organization. Here's the first question. Everyone talks about nurses, doctors, they're our heroes, but as it relates to nurses a year in, and this will be seen later, into this pandemic, how are our nurses doing?
Well, that's a great question, and a question that all of us who rely upon nurses, and all of us do, really should be asking. And, when we started this pandemic a year ago, there were lots of things we didn't know. And one of them really was, what kind of toll would this take on the nurses and doctors on the front line? And, today we face some of the same challenges we did way back when in this endless pandemic we've been living through. There's still shortages of PPE. There are still things that people on the front line need to keep them safe. But really the issue is they've been doing this for a year and they are mentally and physically exhausted. That's how they are. And I had a nurse say to me not too long ago, I still feel like I'm playing Russian roulette every day to not bring something home to my family. And another who said, I feel like I live in prison. And that you really hold with the fact that they show up every day with their knowledge and their expertise to try to make sure that all of us who get into the hospital get out of the hospital and are well. So they're struggling, but they're still there for us.
Okay, we're taping on the 16th of February. Say this is seen in March, April, maybe even into May. And again, if you want to check out what's happening every day, check out NJ Spotlight News, check out Metro Focus, our great colleagues in public broadcasting. But we're looking forward on this. But there are so many question marks. So here's my question. Best case scenario, end of June 2021, with more and more nurses and others around them being vaccinated, what should the situation look like for our nurses by then, and halfway into the year?
Well, I think all of us wish we had a magic ball to look into and guarantee. And what we know is that this virus changes. And so the environment is dynamic. We're all facing that as individuals. I'm not a nurse, but I work with them and I listen to them every day. My hope is with vaccinations, not just of clinicians and frontline workers, but all of those who are willing and able and want a vaccine, that by June, it is a safer environment. We still know, though, that we're gonna have to do things like social distance and make sure we wash our hands and still wear masks. So some of these things that we're living through right now that we are all so anxious to get rid of are gonna be with us for longer, but let us hope that at least by mid-year, people can catch their breath. And for us, Steve, one of the things we know from other pandemics and from what happened internationally early in this pandemic is that the fallout lasts for a long time. And so part of what we're trying to do every day is make sure that when we get to June, when we get to 2022, when nurses really are still processing the trauma that they went through, that we're able to be there and support them.
And by the way, the foundation, there's an economic component to this because the foundation has a coronavirus response fund for nurses. What is it? And is it involved in direct financial assistance to nurses?
Yes, it is. Early in the pandemic, we realized from listening to nurses on the ground talking about what they were experiencing that we were going to need to be able to provide them assistance. And it really was not just helping nurses, but in some ways helping Americans be able to thank nurses and to show their support, because every one of us wanted to do something when we felt so helpless. So we created this fund, and it does several key things. One of them is provide financial assistance to nurses who were furloughed, nurses who were sick, nurses who lost their job, through a partnership with Nurses House. We also support nurses by getting them information that they need, evidence-based information. You remember that early in this pandemic, as we were learning, it was a really chaotic environment. What could you trust? The information was changing. The information is still changing, right? So getting them information that they could trust and that they could use. And then finally, supporting their mental health and well-being. And that's something that we see doing for a very long time.
Could you stay on that, the mental health and well-being? I don't want that just to people to hear, oh, wow, nurses are having some mental health issues. Be more specific. What are we dealing with? What are they dealing with?
Well, we know from really surveying and listening to nurses in May, in December now, that their sense of exhaustion, their sense of isolation, their sense of lack of sleep, all the signs that are somewhat a step towards real trauma and PTSD. You can't expect that nurses and other clinicians who are really doing this in a daily way and have been doing this for months and months and months, with the added challenge, even in combat, you don't have to worry about the safety of your family, that this is taking a toll. And I would say that my nurse colleagues are the first to say, I'll be okay, just I'll get in there and do it again. And we're very concerned that this toll is great on them, and we're hearing them say to us that it's breaking them. It's really breaking them.
Well, in the time I have left, you just open up an area I've been wanting to ask you about. In an effort to be as optimistic and positive as we can, we also want to be realistic. A, are you concerned about nurses leaving the profession? And B, enough qualified, committed folks going into the profession? Kate, got a minute left.
Sure. We do see that more people are beginning to say that they're thinking about leaving the profession. So that's something we're tracking and we're worried about. We also are seeing people that are looking at the heroes that nurses have been and wanting to go to school and become a nurse. So it's still too early to tell, but it's something that we're going to watch for. And I'm so glad that you asked me that question.
You're optimistic, Kate?
I am optimistic because I am surrounded by nurses, but I'll tell you, if we don't take care of them, they will not be there to take care of us. And if anything, this pandemic has shown us that we can have all the equipment, but if we don't have the nurses, we can't make it through.
So well said. Kate Judge is the executive director of the American Nurses Foundation. By the way, their website, Lauren, their website has been up throughout the entire segment. If not, we'll do it in post-production so people can find out more. Kate, I want to thank you, and needless to say, all of us in public broadcasting, all broadcasters around this nation, all Americans owe a debt of gratitude to our nurses every day, not just today or when they're called heroes in the media. Thank you, Kate.
Thank you, Steve.
I'm Steve Adubato. Thank you so much for watching. We'll see you next time.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation. Funding has been provided by Fedway Associates, Inc., Johnson & Johnson, Englewood Health, the New Jersey Economic Development Authority, New Jersey Sharing Network, the New Jersey Education Association, PSC&G, Caldwell University, and by IBEW Local 102. Promotional support provided by NJ.com and by NJ Biz.
I could feel my lungs fill with oxygen, and I got my life back.
The Sharing Network means to me hope, life, and everything.
The Sharing Network was a lifeline to me when I really needed it.
We are an organ procurement organization.
The core purpose of the New Jersey Sharing Network is to save and enhance lives.
To honor those who gave.
Pay tribute to those who received.
Offer hope to those who continue to wait.
And remember the lives lost while waiting.
For the gift of life.